Do you find responsibilities in work, family, and health too overwhelming to handle? Welcome to Health, Wealth, and Relationships, Thriving in the Balancing Act. Join physical therapist and relationship consultant Dr. Gina Williams in building stronger connections, advancing your career, and elevating your overall well-being. Here you'll find practical tips, inspiring stories, and actionable strategies for living a more fulfilling and meaningful life.
Hi, welcome to the podcast, everyone. I am Dr. Gina Williams of Mobility Health Physical Therapy. I have a physical therapy company that's based in Midtown Manhattan. And if you live in Manhattan, you can come to our clinic space or we can treat you in your home. We also do telehealth services to many states in the U.S., so give us a call and you can find us at mobilityhealthpt.com. The podcast is called Health, Wealth, Relationships, Thriving in the Balancing Act. And today's guest is Dr. Jenny Uguru. Thank you so much, doctor, for coming to our show.
Thank you so much for inviting me. I am excited and congratulations on all of your success with your business.
Thank you. But let's talk about you and your lengthy success. Dr. Jenny has the alphabet behind her name. Dr. Jenny is currently the Director of Nursing for Quality Management at New York City Health and Hospitals Woodhull. She's received her associate and bachelor's degree in nursing from CUNY New York City College of Technology, her master's degree in executive leadership and healthcare management from Long Island University, and her doctorate of nursing practice degree in healthcare systems leadership from Chamberlain University. Dr. Uguru has clinical and leadership experience in acute care nursing, ambulatory care, maternal child health, oncology. She's a nurse executive and advanced and ambulatory care. She is also certified in chemotherapy and biotherapy and certified lactation consultant as well, and a geriatric resource nurse. And that I didn't know, and I do have connections for you with that. As a leader, Dr. Jenny has a passion for leading by example and providing quality patient care while addressing the concerns which impact patients and their ability to care for themselves. She believes in the power of nursing as an art and a science to drive quality outcomes and the transformation of organizations through effective strategic planning and both patient and staff engagement. Her passion for dissemination of EBP as a research scholar led to publications in 2 peer-reviewed journals, numerous national posters, and podium presentations, and on invitations to present at international and interprofessional conferences as a preceptor and a mentor. Dr. Uguru has guided, supported, and inspired many nurses and non-nursing staff, colleagues, and teammates. Her focus on wellness and self-care are the foundational tools she encourages her staff, students, and colleagues to regularly use to develop, sustain, and positive work-life balance. Welcome, Dr. Uguru. Thank you so much for coming.
Thank you so much for having me. I am very excited and happy to be here. Thank you. Thank you.
I usually start off every podcast with telling the story of how we came to meet. You want to start it off?
Sure. So we met in high school, Clara Barton High School. I was, of course, the very good girl, and you were the very naughty girl, from what I recall.
That is not true. Jenny is one of my oldest friends. Our friendship spans almost 3 decades. And by that, I just mean the decade. We're not actually, that old yet. Not committing to that. But yeah, we were high school friends. And I think I was friends with one of your friends. And I think I borrowed your books and your CDs before I met you. And I'm like, who's this person who has such great taste in books and CDs? And we met and we've been together ever since. And just knowing and reading your span of career from start to finish, from knowing you from high school to the amazing things you've done over the 30 years, it's lifetimes of accomplishments that some people don't even do half of what you've done. And congratulations.
Thank you so much. And I have to give the same acknowledgement to you. I mean, we started off as teenagers in high school, and all of your successes. I'm proud to say I have been at every single one of your graduations. I have been right there, front and center, to cheer you on, to always wish you success. And I am so glad that you have found it. And this is just one more step in a very, very successful and illustrious career. So congratulations. It is an honor to know you and to be your friend and colleague. So thank you.
Thank you for your support and your love and your friendship. I
Always.
admire you so much as well.
Same here.
So, well, tell me what inspired you to pursue a career in nursing. I don't think I know that one.
Okay, so for me, caring is everything. I think everyone speaks about my personality as just always being a giver, and that's just who I've always been. I knew I first wanted to be a patient care assistant. I wanted to be a nurse's aide. And when it was time to graduate high school and choose a college, I begged my mother to take me to a school in Manhattan that had a nursing assistant program. When we went there, and I was so excited because there were commercials all over the TV. I was like, yes, this is what I want to do with my life. I want to take care of people. And we went there, and my mother and I were sitting side by side with an advisor. And I was just speaking to the advisor. She said, what do you want to do with your life? I said, I want to be here, right? I want to take care of people. This is my passion. And I don't know what my mother said, but I remember her looking to my mother and she said, put your coats on. I need you to go and take her to City Tech because they have an open house today. And I was just like, no, I'm here to be, I'm here for this program. This is where I want to be. And she looked at my mother instead and she said, I need you to go now. And literally, mommy said, get your coat and let's go. We went across from Manhattan back to Brooklyn, downtown Brooklyn. They had an open house for the nursing program. And that was it. I did my interview, did the paperwork, all the financial aid documents. And 22 years later, I am here and still passionate about what I do and still just loving my profession.
Wow. Amazing. Wow. You never know what, going to something may lead you down a path that we don't know, but you just follow that path. If hadn't you done that, maybe your career path might have been different.
Yes. And I always say, you never know who will direct you to what your next step needs to be, because I definitely wasn't looking to be directed elsewhere. I thought that I had a goal in mind, and my entire career has shown me that, yes, I make plans, but God makes better plans.
He sure does.
He has absolutely shown me that his plans are always in my good. So
Wonderful. How has your diverse clinical experience shaped your approach to nursing leadership?
So that is a very interesting question. I think before all of the talk of diversity, equity, and inclusion and belonging became a saying or a thing, I have always felt that it's extremely important to have diversity in what you do and the people that you engage in. I'm very big on collaboration, and I've always felt that having people from different backgrounds, different mindsets, different experiences, that it really makes a huge difference in getting buy-in, to implementing projects, to just making anything work. You really need to have the different experiences of different people to really be able to shape and highlight exactly what it is that you need to get done. Every voice matters.
Wow. So you were ahead of the DIY trend before it even had an official coined name.
Absolutely. And I'm still on that journey today because I do feel like you never stop learning. You never stop growing. So I am continuing to do all of the DEIB training and to utilize all the resources that's available to continue to move nursing along into the next generation.
Amazing. And so As a director of nursing, tell me one of the challenges that you've faced and how did you overcome it?
So one of the challenges I face is usually pushback. And what I mean by that is that as a nurse, and as I said, I've been a nurse 2 decades now, nurses need to know why. It's very important for us to understand why we want to do some things. And sometimes things are from the top down, right? And I call them just do it, right? A lot of times, executive leadership may not tell you why something needs to be done, or all of the explanations of why it needs to be done. We just get the directive that it needs to get done. So my biggest challenge is being able to get my staff to understand the reason why some things need to get done, even when I don't fully understand. It's
Mm.
really getting that buy-in that I mentioned earlier. And as I said, getting the buy-in for nurses is everything, because we really don't do anything unless we understand why we're being asked to do it. So the biggest challenge is definitely trying to get everybody on board when things need to get done. And the way to overcome that, as I said, diversity, bringing people in, letting people do as much decision making as they can. And I'm talking about the staff, the leadership. It's really having that interprofessional team to really move things along.
Wow, that definitely does make a difference. And so, how do you ensure that the care provided at your hospital is at the highest quality standards?
So that's a very good question. I feel that data is the wave of the future. And because I am in quality management now, and I've been in this position almost 2 years, I understand the impact of data. So to know where you need to go, you have to know where you are, right? So a lot of what I do is looking at the benchmarks and then developing plans on whether it's evidence-based projects, performance improvement or quality improvement projects, to be able to get us from where we are to where we need to be, and really comparing us to other facilities like us, right? So I'm always comparing us to our sister facilities because we have an 11 acute care hospital. And I compare us to other teaching hospitals according to our bedsides, our census throughout the nation. So that's what I do to be able to improve quality, and a lot of education.
Yeah, education is key. You have to keep learning. And so, in terms of the social differences between workers and patients, how can healthcare practitioners like yourself address that amongst the team and patients?
So that's another great question. So one of the drivers to receive my doctorate degree was exactly that. The social, and I mean, we didn't rehearse this. It's just amazing because the social determinants of health is really what drove me to get my doctorate degree. Going from inpatient, where I primarily worked, to ambulatory care, I was able to see how these social determinants, education, job, food, housing, for especially for our patient population, I was able to see how it really impacted people's ability to be able to take care of themselves and to take care of their families, the impact that it has on the community. As a public health hospital, we always speak about having access to care, but you have to look at people in rural communities outside of New York City that don't have that access. People who are immigrants or just came here who are scared to receive medical care because they don't know what's going to happen when someone knows their name, right? And really seeing how that impacts our patient population. And I've always been passionate about children and the health of children, and the health of mothers has always just been a very strong passion of mine. And it really drove me to say, what can I do to address these social determinants of health? What can I do to break down these barriers so that people can receive this quality person-centered care? And that has really become my mission in life, is to address those barriers.
Wow. And that kind of leads me to my next question about how do you discuss the importance of self-care with your fellow practitioners and the patient? How do you get people to understand how important taking care of yourself is?
So another important question, as we know in healthcare, and I'm sure you've known, anyone who's picked up a book or read or watched TV has spoken about the nursing shortage, right? And this shortage of healthcare workers. Today is actually for Suicide Awareness Day. And we had a webinar today about physician suicide because that is the largest group of suicides amongst healthcare workers. So wellness and self-care has always been integral to what I do and what I teach and what I practice for myself. I tell people it's important to have a balance between work, life, school, and anything else that you can add on to it. There has to be a balance, and that's how you prevent things like burnout. That's how you prevent things like compassion fatigue, all of the alarms that are happening, that people hear that are impacting their ability to do their work and not focus. Taking care of yourself is important. And that's really how you prevent those things. And I always take it one step further because anyone who's known me as long as you have know how important I feel to be your brother and your sister's keeper, right? It's not just to take care of yourself. It's to tap your colleague on the shoulder and say, this patient was very challenging. Go and take a 5 minute. I'll take your patients, and being able to look after, and whether you're doing it at the bedside or in the boardroom, realizing that some people may need a breather. We have wellness rooms now. We have a whole bunch of meditation sessions, and I played musical bingo the other day just as a way to de-stress with the team. It's all about self-care and finding those moments to take care of yourself that allows you. And as I say to my staff, if you're well, and it's my staff, meaning my nurses and my colleagues, if you're well, I know my patients will be well. My
And
priority is really you.
that's so important. And that answers the first half of my next question about what do you do for your teams and some tips for them to de-stress. And so now, personally, tell us what you do for helping to manage your work-life balance.
So for me, I love karaoke. So that's what I do outside of work. I do enjoy just, karaoke. I love music. I read romance novels. I crochet. Yes, I'm the little old lady.
That's what she was doing when she was 14.
I was
Well,
doing it.
one of the things.
But I learned to do it in vacation Bible study at 12. I was crocheting little pot holders for the neighborhood. I was that girl. So those are the kinds of things that relax me because it takes my mind away from everything. It's that sort of well, for the romance novels, it's sort of like everyone is happy and the ending is always just joyful and happy, which also brings me joy. The crocheting is just like that rote memorization. So it just sort of takes your mind off of everything except for creating this pattern, which then develops this wonderful work of art. So just those little things. And of course, music, dancing. I love those things because once again, when you're in a place where you're enjoying music and you're dancing, you really don't have time to focus on anything else. Your mind and your body and your spirit is in sync with whatever it is that you're listening to. So those are the things that bring me joy. And sleep, which I don't get enough of, but I wish I did.
Wow, thank you for sharing that personal aspect.
You're very welcome.
So, how do you think the role of nursing in the next decade will evolve, especially in healthcare systems leadership?
Another great question. And it's a conversation that I actually had with one of my colleagues today, which is really about nurses working to the top of their license. And it's something that I've heard about and everyone has spoken about for years. And when COVID happened, it's COVID-19, the pandemic happened, it really gave nurses a level of autonomy that we never saw before. And I say that about New York State, right? Because every state has their own board of nursing that that dictates what they can and cannot do. And New York is one of the stricter states, for lack of a better word. So the level of autonomy that nurses were given sort of pushed nurses to be able to do more. For example, every order previously in a hospital required a doctor's order, meaning you had to have a physician, whether it's an MD or an NP, a PA, someone had to write an order for you to be able to carry out that order, right? When COVID happened, and right prior to COVID, we were entertaining the idea of non-patient specific orders, which meant that now I, as a nurse, could have a visit and I could give my patients specific things based on my expertise, right? I have 22 years of knowledge. So I would like to think that I'm an expert in some things, right?
Yes.
So if I knew that my patient needed a pneumococcal vaccine, for instance, right? They're 65, they used to be a smoker, they have diabetes, and I know that all of these are risk factors for them developing pneumococcal pneumonia, right? I'm able to give that vaccine. I've identified the risk factors. I said I give my patient the education, which is what I did anyway, and I order it and I vaccinate. That was never a thing prior.
Wow, that's
right? So
streamlined.
Exactly. So given nurse, and now you're not waiting for someone else to put in an order for you before, and then you have to put the patients back outside and these kinds of things. Giving nurses this ability to be able to do what was in the best interest of their patient, I think that is the next step of nursing. I think that that's something that has to, when we speak about value-based nursing, the next thing is that nurses are, when you look at bills for hospital care or for primary care, the nurses are lumped in with like the table that you put supplies on.
Oh,
And
wow.
syringes and the needles. Yes. So the provider is one visit, and then the nurse gets lumped in with everything else, right? The medication we administered and the syringe.
Know that.
So value-based nursing is a big thing that is now coming to the forefront. And there are groups of people by professional organizations that I'm members of that are looking at what is the value of the care that nurses provide. And part of that begins with, what is it that nurses do? And that is where working to the top of your license really comes into play.
Important, so important. And so can you talk a little bit about the significance of evidence-based practice in nursing quality care?
Absolutely. Evidence-based practice is really the cornerstone of quality care. It's everything nursing and healthcare. There are a lot of resources for nurses, but my specialty and the reason why I decided to get my DNP, which is my Doctor of Nursing Practice, is because I wanted to be able to really get into the literature, see what's already been done, see what's been tested, tried, and true, and then spread that, right? So then you're able to use the evidence that our PhD scholars have already developed. And then you're able to use that to drive the quality in your organization. So evidence-based practice is really the way that everyone should be practicing across all disciplines. The way things used to be, as we know, and you're a healthcare worker 22 years ago, is definitely not the way that things are working now, right? The technology is different. Innovative things that's happening, the way we document and are required to document is different. Information technology, artificial intelligence, all of these things are really starting to come into play, and we really have to see how the evidence impacts the quality of care where all of those are concerned. So I am here for all of it.
Yes, me too.
I'm here to research, study.
Yes.
I want to be involved. It's really exciting. And I'm just trying. And I recently, February, I wrote a journal on American Nurse, which is a peer-reviewed journal by the American Nurse Association that really spoke about the nurse's role in artificial intelligence and how we can get prepared. And I'm here for every single last second of it. I'm excited.
What are the key elements of effective strategic planning in healthcare, and how do you implement them in your role?
Another very interesting question, because just last week I I met with my with my deputy CNO to review the nursing strategic plan for the next 5 years. So very interesting that you mentioned that. So strategic planning is essential, regardless of what profession you're in, what title you have. As I said earlier, you have to know where you are and develop a plan for where you need to be. I recently had a meeting with my CEO who pretty much told me the same thing as I was speaking about my own career path and where it is I see myself. And that's strategic planning, right? You have to say to yourself, this is where I aspire to be. Let me see what the steps are for how to get there. Strategic planning ties in all of the things that we mentioned before: quality care, technology, innovation. What does nursing look like 5 years from now? What are some of the new things that are coming up that we should be looking at? Health equity, DEIB, artificial intelligence. All of these things are the things that are being spoken about now, but what's going to be spoken about 5 years from now? And that is what strategic planning is. It takes into the evidence that's out there. It looks at what other people are doing, not just here in New York, but across the world. There are places in in the United States right now that people are using robots, physical robots, to be able to help with hygiene, to bring towels and water and things like that to patients, to be companions or sitters. Those kinds of things a lot of people are not doing, right? People haven't even thought about it. So when you think of strategic planning, it's really looking at all of those factors of nursing and what you plan to do in the next 5 years. And the other big part of strategic planning is succession planning, because I plan to retire one day.
Yes.
And I need to, it's time, right, to start grooming the next set of us, right? Because it's not just me who plans to retire on a beach. You're my friend, and we will be on the beach possibly together from time to time. So you have to start looking about teaching and training the next generation.
And yes, my next question: how do you mentor and support the professional growth of your nursing team and non-nursing team?
So mentorship is another passion of mine. Last year I received the American Nurse Association New York Award for mentorship. Thank you so much. Because I tell people mentoring isn't something that I do because I have to. It's something that I do because I love to. And I've always been this person. I've always wanted to guide and advise people when they speak about nursing in the past, where people used to quote unquote eat their young. Nobody wanted to share knowledge. I'm like, what is this, Shark Week? Nobody is here to do those things. That's not how you move your profession forward. To move the profession forward means that every single thing that I know, I need to be able to impart that on the next person and the person after that and the person after that. And if people don't want to become a nurse, if they want to become a physical therapist, if they want to be a doctor, if they want to be a housekeeper, if they want to do food and nutrition, if they want to be sanitation, regardless of where people's path is, I'm able and I love to be able to just give them tips and tools and tricks to get there, because we all need each and every single person in all of those professions and occupations that I just mentioned. That's what mentorship is to me. It's growing the next me and the next person that I will report to one day.
Yes.
And the person that will be taking care of me if I'm ever laying in a hospital bed one day.
Yes. We all may need care at some point in our life.
Absolutely.
And so what role does interdisciplinary collaboration play in achieving good patient outcomes?
So it's a very big role. That's where I speak about having the different voices in the room, having the diversity, having people with different experiences. It's the best way to get buy-in, collaboration, communication. by having those, what I like to call is interprofessional team members in the room. Because to me, everyone who's ever in a room with me is a professional in their own right, right? And that's just the way I see people. You know, if I'm in a room with you, we're having an interprofessional discussion because I respect you for your expertise in what you do. And that is every meeting that I have, everything that I do, every project that I implement is always interprofessional because I know that that is the only way that I can drive quality outcomes.
Amazing. And so can you share a memorable experience with the patient care that has influenced your career in some way?
So a memorable experience in patient care, I would have to say it's usually just thank yous from family members. It's when you have really sick patients and they're able to walk out of the hospital. A prime example, and actually I spoke about this recently with someone, because we have a new wellness director. And as I said earlier, we were playing musical bingo. And it was a wellness event where they played songs that were about resilience. So every song they played was about resilience. And one of the songs they played was Andra Day, which is a beautiful song. And I did win bingo, by the way.
She's very competitive, hence all her accomplishments and accolades.
And she wins everything, but that's another story for another day. So Andra Day played on, and I was just moved. And they looked at me and they were like, Jenny, what's going on? And I said, during COVID, when our first patients were discharged from the hospital, our COVID patients who were so sick and literally on death's door left the hospital, this was the song they played. And I remember being in the corridor on the main lobby because I was still covering ambulatory care that time. And the song played in the overhead speaker. And I and patients and everyone just stopped. And tears were just flowing down everyone's face because we knew that we discharged home our first COVID patient. So when we speak of memorable experiences, that for me was one of the most moving experiences.
Wow. That's touching. Can we hear a little bit of the song? Okay, not today. All right. I tried, guys. You're the great singer. All right. So tell me, Dr. Uguru, what's next for you? What's your next project, your next endeavor? What are you working on for the next year or so?
So my next endeavor is to be back in school.
Lifelong learner.
Yes, I know I have a terminal degree, which means that I should be done. But, I still have things on my bucket list. I still, as I say, I still want to address those social determinants of health. I want to be able to impact care for rural places that don't have access to care. I still want to do some clinical work. A lot of the work I do now is data-driven, performance improvement projects, and quality improvement. I do want to go back on the clinical side and do some things to affect positive outcomes on the clinical side and have a good balance between the two. So on the horizon is definitely more education, more mentorship. I have 3 doctoral and 2 master's students currently. So very busy where that's concerned. And of course, continuing to grow my career professionally because I absolutely love what I do. And I'm very passionate about the work that I do. So I'm enjoying every minute of that. And lastly, community involvement. I love to do volunteer work and to just be part of the community and to give back because it's not just about caring about myself or my friends or my patients or my staff. It's about truly giving back to the people that's around me.
Wow, very important, very inspiring. And, another part of the alphabet's going to be on Dr. Uguru's name. She's amazing. She never stops. And that's what I strive to be myself as well. Thank you so much, Dr. Uguru, for being a guest on the podcast.
Thank you so much for having me. This was fun. Thank you. And still, always wishing you so much success.
Thank you so much. And so if anyone's looking for this podcast with Dr. Uguru, you can find it at mobilityhealthpt.com. Tune in next time for the next podcast with Dr. Gina. Take care.
That's all for this episode. May this discussion full of actionable tips and valuable advice guide you towards better possibilities in your personal and professional life. Continue your journey of unlocking your fullest potential by listening to more episodes of the podcast at mobilityhealthpt.com. Achieving stronger relationships, securing a thriving career, and embracing a healthier lifestyle may be daunting at first, but it is not impossible. You have the power to unleash the best version of you today. Until next time.